Lake Superior Life Care and Hospice provides compassionate medical care for those facing a life-limiting illness. Hospice services focus on helping patients and families live comfortably for as long as possible. Hospice is a team-oriented approach that includes professional medical, social, emotional, and spiritual support during this difficult time. This educational series will cover a variety of topics related to the various roles of the hospice interdisciplinary team. Nursing.
Hi, I'm Reagan Schumacher, and I'm an RN case manager at Lake Superior Life Care and Hospice. So my job entails seeing patients in the home and at skilled nursing and assisted living facilities. We oversee or are a second hand in a patient's care regarding hospice. So my day usually consists of seeing my patients, of course, and I see them, I can see them once a week or I can see them every day a week, depending on what their level of care needs are. We are also involved in the admission process as well as transfers from facilities to home. We do a lot of education with staff and family members regarding the care of the direct patient. So what the nurses usually work with patients for are teaching about medications and how to care for a dependent patient generally. We do a lot of education because our agency doesn't provide 24-hour care. So we work with aides and social work and spiritual care services to make sure that a holistic approach is achieved with the patients. But that does involve a lot of education. As far as facilities, we work with the staff as kind of a second layer of support. And we can do that just by educating and making sure that all their medication needs are covered. We can do that by all the care by telehealth or visits in person. And we can also do multiple check-ins through the week by following up with phone calls. Our hospice agency's team approach starts at the very beginning of the day with morning report. That addresses any sort of patient issues that came up overnight or occurred the day prior, especially things that might require some extra attention. All of our chaplain and social services, as well as all of our nurses, are kept up to date on each of our patient cases through these reports. We also get together every 2 weeks for interdisciplinary team meetings, and we call them IDT, and that's when our current on-call physician and sometimes our usual pharmacist is available, and we go through goals and things that have been achieved in the last couple of weeks, and we address any sort of issues there as well. We also have care conferences that can occur between families or facilities, and that's a routine thing that happens, but it can also be facilitated if there's something that needs to be addressed. So the interdisciplinary team highly benefits the patient and the family by making sure that all facets of their care are addressed. A lot of times in hospice, there's a lot of spiritual pain or unresolved issues, and we're able to collaborate with the spiritual care team and the social workers to make sure any sort of stressors or monetary issues or just getting people to the place that they need to be, whether that's spiritually or physically, is something that can be addressed by that part of the team. A lot of times if those needs and stressors are met, you might not have as many care needs that the nurse might have to provide. But from a patient and family's point of view, I believe it means that they feel well supported, that they have resources that they can call and have their questions answered. I definitely think that working in hospice is more than just a job for people. I personally feel that I'm able to give the care that I want to provide, and I feel that there's a different focus as far as time and resources to make sure that it's not just a box being checked, it's people actually verbalizing that they feel supported and that their family members are comforted, in their transition at this period at the end of their life. Overall, the things that really make my day, even at work, if you could call it work sometimes, is just knowing that people get to be cared for, in their home or a place that they feel comfortable. They're surrounded by family, they're surrounded by their pets. They may finally be able to be back in their own bed after having a really long course of, preventative care. I always feel very welcomed by the families that I work with, and I really enjoy feeling welcome in their house and developing that relationship. I've gotten a lot of feedback and support and just saying thank you so much for being there. A lot of people say thank you for keeping me so well informed, and just providing them with education, seeing their family member progress towards the end of their life. I really wish that the community understood that hospice is really more about life than it is about death. I think that there's a lot of dignity and a lot of comfort that comes with focusing on symptom management instead of curative care. I think it provides the patients with more time where they feel better to be, more like themselves and spend time with their families and do the things that they want to do. And I think to emphasize that there's a lot more time and resources available when that decision is made to transition into hospice.